Hello, welcome to Wondermous. My name is Merikay Hunt, and I'm the host of the Healthcare Leadership Journey. We have met some amazing leaders over the last several weeks, launching season 1. And today we have another amazing leader. And I just told him I'm prayerfully not going to be too intimidated by his business acumen. But let's welcome Keith Pinter, and he's going to tell you a little bit about Arista MD. Keith, what inspired you to get into your healthcare leadership journey?
It's a great question, and I'm really excited to be here and love the fact that you're focusing on leadership and you know healthcare is really about change and change management, right? We've
Yes.
got to change as patients how we think about interacting with our clinicians. As clinicians, we've got to think about how we interact with our patients. The whole ecosystem is in a series of change, which is exciting. And it also
Right.
creates a lot of opportunity for leadership. And leadership effectively to me means doing things, the right things, and doing them differently than how we've done them before. So much of my, early part of healthcare in 2010 was really it was like efficiency. How do we do the same stuff better? Well, that's
Mm-hmm.
not the answer to a system that, today, 1/5 of our entire GDP, our whole economy is spent in healthcare. People say that's why
Mm,
we've got the best outcomes and it's a great system. Well, here's the reality. That's not the result. We
mm.
we as a nation are in the bottom third of outcomes globally.
Wow.
So for
That's just
us to spend,
amazing to me.
yeah, right. So if for the amount we spend, you'd figure we'd be in the top 10%. We're at the total other end. So that means we can't have the same type of leadership thinking that we've had in the past, right? Because the old definition of insanity, continuing to do the same things and expecting different results. So we need people to think
Absolutely.
differently. And that's really what led me into healthcare. God, I began my career in the technology ecosystem. And I was
Okay.
fortunate in the sales side of things and then ultimately buying and building and selling companies. And, I saw that, making money is never a bad thing. It's also not, for me, the fulfillment side of things.
Mm,
So as I was thinking about what do I want to leave as a legacy for my kids,
right.
I looked at the areas that could use the most change, where I could take what I learned in the technology industries, which are really how do you use technology to solve meaningful business problems? And if you do that really well and you really listen to customers and you work with and you solution with them, you can be
Mm-hmm.
really successful. And I looked at healthcare and I said, if there's something that I could really make a difference in, hopefully it would be this. And maybe some of the lessons I've learned in technology, because healthcare, when I look at healthcare, especially the provider side of healthcare,
Mm-hmm.
not the insurance company or the payer side, the provider side of healthcare, so docs and clinicians and hospitals, in general, it's about 10 to 12 years behind the way the overall world uses technology in the lessons that we learn. So I said,
Right.
this would be interesting to take what I've learned as a change agent and bring that forward. And I was fortunate to come into healthcare at a Fortune 500, or what was one of the largest, I think it was the third largest publicly traded healthcare system, Health Management Associates in the country, under a new
Mm-hmm.
CEO, a new group of leaders. And we really were taking a hospital system that had been around for a while and transforming it. And we were coming in at the point in time, the new leadership team, that is, was coming in at the point in time where there was a structural change. The way that docs used to take notes, not the electronic medical record notes, where docs actually looked at you and might
Right.
write something down on a piece of paper instead of typing away and occasionally looking up at you. Um,
Right.
that was the whole meaningful use change that happened, the introduction of electronic medical records. And it was a great idea of how do you take all this data, right, that was handwritten, and how do we start to create a better knowledge repository so we can start to look at better outcomes and sharing best practices. It was fascinating getting in and hearing, Mary Kay, that the leadership in those hospitals and really at more the boardroom level, the leadership was like, you know, when we've already chosen a health record, these docs are going to do whatever we tell them to do. And my question was,
Mm,
boy, after growing up in technology, I always thought that the people that you'd have a steering committee, and especially like dealing with docs who really are about delivering great patient care and that relationship.
right.
It was fascinating to hear that wasn't the case, in the
Mm,
mindset. And fortunately, I was able to help myself and the rest of the new leadership team was able to bring a different focus. And how do you empower clinicians to deliver the best in patient care? Because if you keep the patient at the center of things, a lot of problems solve for themselves. When we
right.
don't, we create a lot of other problems. So it was fascinating, learned a whole lot, and we grew the business by about 50% to about 7 billion in revenue, which was pretty large, and then sold it. And I said, okay, I think this prevailing mindset of hospitals who really were focused back then on heads in beds or people that were
Yeah.
spending time in the hospital rooms or operating room revenue, those are the two drivers. Well,
Hmm.
you can't really get better focusing on those two things really aren't about improving patient outcomes, and it certainly is not about reducing cost.
Right.
So, said, this is interesting. I really want to focus more on the doc side of things and how do docs work. So I was fortunate to join another relatively large group, Sheridan Healthcare, which was one of the larger specialty physician services groups. So anesthesiologists or radiologists or ER docs or hospitalist medicine docs, those were the ones that when you were in the hospital, really cared for you. Said, okay,
Right.
this is interesting. We grew the business from about 800 million to a little over 2 billion in a couple of years. And then we merged with another organization called Envision, and that created the largest group in the country. And I ultimately served as COO of that. We were about 20,000 fully employed docs and about $6.5 billion in revenue. And the
Right.
thesis was creating a national home for docs. And I think it was it was a noble thesis. The challenge is healthcare is largely local.
Mm,
And, there are subtle differences at every local level. So one of my big learnings was, you can have 80% consistency in a playbook, but that last 20% is really what matters and dialing that
right.
in. And then, there's all this talk about what we heard value-based care.
Right.
And when I looked at value-based care to me is simply saying instead of a doc being paid when the patient comes for sickness or the broken arm or something else, and they get paid on a per transaction basis, the clinician's getting paid for the total cost that patient incurred cost wise in a year. So, how many times did they have to use the hospital? North of
Mm,
70% of hospitalizations are unnecessary, and 82% of ER visits are unnecessary. So, said, well, wait a minute, this doesn't make sense. Well, we're not compensating people to fix that. We're compensating them to just see more people. That's not what docs trained for. That's not what they
right.
want to do. So value-based care allows for changing of the economics. So instead of a doc maybe getting paid $700 a year to care for an average senior patient, a primary care doc, in this model, that primary care practice would get paid, let's call it $10,000 a year, but out of that $10,000 a year, anytime the patient went to a hospital, the ER, a specialist, all those things would come out. So what it really said is you could inspire and pay a clinician, a PCP, or a nurse practitioner at a PCP practice on being the quarterback of all the care. Because so many patients are left in the
Hmm.
wild today, they don't know where to go. And especially as we age, it gets even scarier. So the idea of value-based care I saw as a really exciting time. And what I saw with that is this big company with all these docs, by the time somebody got to a hospital, it was too late to do the care. So
Mm,
true value-based care, I came to find and understand was really about two things. One, about chronic disease management. So things like heart disease or
right.
cancer or like hip replacements in the orthopedics. There are 9 chronic disease states that represent 80% of the total spend in healthcare. And if you follow the math and you do things like what other industries that have successfully gone through change do, follow the dollar.
Mm.
And so I said, okay, this is interesting. Looked at a couple of those and found that there are more silos.
Mm.
And patients may have a cardiovascular condition. They're going to a cardiologist who gives them meds. Then they've got a lung condition. They're going to the vascular person who treats them. Then they're going to the orthopod who treats them. And those people don't really talk amongst each other. So we have more silos. We don't
Well,
need
and
more.
then that plays a role into, the communication education of pharmaceuticals, of treatment
Yeah.
plans, of home life. And if there's no sync between those systems, the patient suffers.
Yeah. Well, and that's it, right? So if we begin with the patient in mind, so what I saw is there's a huge role for the primary care physician, right? And,
Mm-hmm.
and the timing of value-based care becoming more real, the payment mechanisms that are out there with accountable care organizations and the REACH program with some of the advancements with Medicare Advantage, it was the right time to try a different model to empower the PCP, to give them the
Right.
data, to give them the tools, to give them the compensation, and to give them the time to do what they want to do, which is deliver great care for the patient. So I was fortunate to found a company called Rise Health, and we ultimately raised a couple of $100 million for it. And it was acquiring primary care practices that were in that old model of fee for service or being
Right.
paid on a per transaction and moving to a value-based care model. And in the
Mm-hmm.
process of doing that, we found that there were a couple of key elements that were kind of missing in the solutions in the market. And one of those was specialty care. So things like access to a cardiologist and timely
Mm-hmm.
access. And what does a good cardiologist look like? Or a good MSK, good orthopedic person for the knees or the back or the hips. And there were some interesting solutions that were there for insurance companies, but not for primary care docs. They actually were creating more confusion for the patients. They didn't know who to go to for what. And if I'm a primary care doc, the relationship I have with my patient, I should be the first call as a
Right.
primary care doc that the patient is coming to me. So I was looking at a company called Arista MD to kind of be a specialty care solution for some of these more costly disease conditions that we talked about, so that a
Mm-hmm.
primary care doc could actually have an immediate when the patient is there. So when Aunt Judy is seeing the primary care doc, the primary care doc could immediately determine if Aunt Judy actually needed to see an orthopedic surgeon or if there was another thing there, and then
Right.
could actually get them in instead of waiting 6 months and not knowing what was happening. So that ultimately led to me joining Arista MD to solve for this access to specialty care problem. So, especially again, as we get older, our bodies wear out faster and they're more complex. So, our ability to create a different way to care for those patients, that's
Mm-hmm.
what Arista does. So, there are many people that kind of are talking about specialty care and access to specialty care. Arista actually delivers on it. We work with some of the largest primary care groups in the country. We've been doing this almost a decade. We've seen hundreds of thousands of patients. So we have robust data sets. And most recently, Time Magazine awarded us as one of the top 100 companies in the world to look out for in healthcare. And that was a big
Wow.
award because we're a younger company.
And so, is this a web-based platform, Keith? Kind of
Mm,
explain it to our audience so they know exactly what
yeah.
it is.
It's a good question. So, um, a patient, many folks in the audience would never interact and probably will never act with Arista MD. We work with their primary care doc. So, their
Mm-hmm.
primary care doc would be, because everything is EMR based, um, our nurse navigators are inside a primary care doc. So, let's say I'm a primary care doc
Okay.
and Aunt Judy comes to see me. As I'm treating Aunt Judy and I'm going through my documentation, I come to this orthopedic thing. What do I do here? Does she go out or not? And then who would I send her to other than, Joe, who I play golf with? Um, so they simply make a little note with 2 clicks of the mouse or 1 click of the mouse. Our nurses then take that full piece of information, gather all the information about the patient, because you don't want a primary care doc doing all this administrative stuff. One spending more time with patients. So
Right.
gathers all this and then routes it to a specialist who looks at it and says, Aunt Judy probably does need to see a specialist, but you could start in PT, or Aunt Judy does it and hear the recommendations. And that
Mm.
comes right back to the doc in the EMR. So in
So
electronic medical record.
accuracy, timeliness of care, patient experience, there's a lot of benefits to this
Yeah. And,
model.
and, and I think the most important one you get to me is patient experience in there,
Mm.
because how cool is it for a patient who said, I went and saw my doc. Uh,
Mhm.
Turned out I didn't need to go see a specialist, and here's what they found. Here's what I need to do. Or, oh, I did need to see a specialist. And by the way, when I need to see a specialist, instead of waiting 6 weeks to 6 months, my doc got me a televisit, and I'm now comfortable because COVID, probably the
Sure.
biggest positive byproduct of COVID was people are more comfortable using their
Right.
phones, right?
Right.
So they talk to a specialist in 2 or 3 days, and that specialist isn't incented or compensated to do a surgery. The physician is incented to do what's right for the patient. That information then goes right back into the electronic medical record. The
Mhm.
primary care team is aware. So now my primary cares are like, I know what's happening with Aunt Judy. I know on a real time basis. So I'm now happier. And boy, when you talk about then the cost of that, now we've
Right.
taken out a lot of the waste and inefficiencies of the system. So it really is a trifecta: patient in the center, happy docs, equal healthy
Yes.
patients and happy docs usually equal a lower cost of care. And it's the way the system was designed. So it's really neat to be at the center of trying to figure this stuff out.
Well, happy docs, happy patient means also happy team members, which I really like that part.
Love that. Very well said, right? Because happy docs and nurses, right? Happy clinicians, caregivers, right?
Yes.
When they're happy, everyone else is happy. And most of the time they're not, because of all the darn administrative stuff they got to do.
Right.
And the staff is the one who bears the brunt of that. Great
Well, and
point.
it's interesting because as you were sharing the backdrop, I remember the day when I had to go pick up films and carry them to another office. So I'm like, okay, I'm dating myself here. I get that. But the other thing too that I really want to hone in on to help somebody, let's say we've got a professional out there that really wants to take a risk in their profession and try to do something differently.
Yeah.
And what words of wisdom or encouragement would you give to that person? Because you were able to step out of your technological realm and jump into healthcare. And there was some driver behind that. So share a little bit about that.
Great question. So I think the first one is, one, be intellectually curious, right?
Mm,
Like why is something happening? What are the drivers behind it? And
mm-hmm.
then when somebody goes to make a change, when they go to a different station in life, whatever that is, whether it's a doc who's been seeing patients, moves into leadership or administration, or goes and
Mm-hmm.
starts a company, what problem is being solved for? And,
Right.
and beginning with, being curious, then what problem? And then, the next one is go and talk to people and see how big that problem is. Because
Mm-hmm.
if it's not a meaningful problem to solve, everyone's busy today. And the best solutions oftentimes get left behind because they're 80% there. They don't fit into, and they're not easy to do. So
Right.
understanding what those are, I think is the second thing. And then the last thing is, I kind of referenced it in the beginning. When I got into healthcare, so much of the focus was on efficiency, which is kind of
Mm-hmm.
doing things right. I
Right.
think we need to focus on effectiveness, which is doing the right things.
Mm,
And so somebody coming in with a different mindset, that's like the innovation. Be willing to try different things.
right.
Create a sandbox, be comfortable. And especially for clinicians who've been trained to be, don't do anything unless you're 100% sure. The real world doesn't work that way.
Right.
Be comfortable. You're not treating a patient whose life is in jeopardy. It's okay to be 80% correct and try something and iterate versus 100%, because by the time you even get to 95%, the world has changed. It's 5 years later. So it's just recognizing that. So those would be the pieces of advice, as well as pay attention to the macro environment, or what's going on in like payment stuff, what's happening
Mm-hmm.
with payers. All of those pieces affect change.
Absolutely. And I love that you use the word legacy because, if today were our last day and we looked at everything we've done up until today, how have we made a positive, purposeful difference in the world? And with that, as we kind of come in for a close, this has been one of the most powerful questions that we've asked people. And if you could talk to your younger self and really have this transparent dialogue and give yourself some words of wisdom or encouragement, what would you say, Keith?
I think the first is continue to invest in myself and
Mm,
in others. And if I
mm,
invest more in others, that's the best way to succeed. Because instead of having to do it all myself, if I've got the right people that either work for me or work with me, super important. And if I spent more time, this kind of goes to the effectiveness versus efficiency. If I spend more time talking about the what and the why,
mm,
and then give them space to figure out the how, they're going to find way better things. And my life would have been way easier because I had some brilliant people that I micromanaged a little too much. I thought it was about that operational efficiency it,
right.
instead of effectiveness. I think those
Mm,
are two key things. And I think the last being in healthcare. Actually, I'll make one other sidebar on the developing others. So one of the neatest things that we've done at Arista is we've created what we call a leadership lab, where we've taken not the senior level leaders, but that next level down of folks,
mm-hmm,
and some of them are newer into leadership. And we meet biweekly. I actually lead the lab, and we cover different books like First Break All the Rules, or
mm-hmm,
Getting DFs, or Danny Goleman's book on emotional intelligence, and we unpack it and we talk about how to use those things in a practical environment. We've now created a really powerful support group for those people, and we've
mm-hmm.
trained them on what's happening in the future and taught them how to invest in themselves. And the joy of seeing them as a leader, that's the biggest joy that I get. And as more people do that, they kind of get back to the joy. And we talk about the joy of practicing medicine. The joy of leadership is also there, and it doesn't come from getting everything done on our to-do list. It comes from
Right,
helping people be the best that they could be. And that kind of goes to my last point in healthcare. Don't do things to docs or clinicians. Don't do things for docs or clinicians. Do them with. And that
mm,
creates a culture of care and
mm,
engagement and teamwork. And if I'd done those three things early in my career, or even early when I got into healthcare, some of the gifts that God entrusted to me, I would have been able to put into service earlier and have had a greater impact. Fortunately, I have been able to in probably the last decade of doing that.
oh, I love that. I think we've just discovered your new collaboration model that needs to be trademarked.
I love it. I love it. And rest assured, you get co-credit on that, co-creator credit.
Excellent. Well, thank you for the investment of time. And let's reemphasize that knowledge, education, it is priceless. So thank you, Keith, for participating today on Wondermous, a healthcare leadership journey. And if you want to learn more about Coach MK, please visit our website, coachmk.com. Believe in yourself, believe in your team, believe you can go to the next level. And if you need a little help, we're here to be beside you on the journey. Blessings, and thanks again, Keith. Make every day count.
Thank you very much. Take care.